Penile implant surgery. Your questions and answers with Dr. Christopher Love, urological surgeon, brought to you by fixED, www.fixed.net.au.
Well, erectile dysfunction really is the inability to get an erection or keep an erection for long enough to have satisfactory intercourse. All sorts of degrees of it, from not getting an erection at all through to just not being able to get a hard enough erection. But I think in the end, the practical definition is if a man can't have satisfactory intercourse because his penis isn't getting hard enough, that's erectile dysfunction. ED is caused by a variety of things, but the most common cause is related to vascular disease. So that is men who have problems with blood circulation throughout their body, commonly men that have got problems with their cholesterol, with high blood pressure, diabetes, etc. Those men commonly get ED. So the largest group of men are really those with vascular disease, and then we've got other specific causes such as related to surgery in the pelvis where the nerves or blood vessels may be damaged, related to conditions of the penis itself, particularly a condition called Peyronie's disease. Certainly there can be psychological issues. Men can have other diseases of the nervous system such as multiple sclerosis or Parkinson's disease. So all of those can be associated with ED. But the largest group really are men who have got poor blood flow into the penis because they've got generalised vascular disease, which can affect other parts of the body as well. Certainly for most men a cause of erectile dysfunction can be identified, and we set out to do that. And indeed, once we've identified a cause, then we can put in place treatment that will hopefully rectify the problem for them. Well, certainly the options for treatment for men are multiple. We try and address a lot of the lifestyle issues. That is, if they are overweight, we get them to lose weight. If they have diabetes, we want to make sure it's treated correctly. We want them to stop smoking. So all the things we can do to improve their general health and particularly address some of these vascular disease issues. So that's a very important treatment step for men. And then we really have a number of treatments starting from oral medications, the drugs that work by reacting on the blood vessels inside the penis to open them up and cause a better erection. We can use injected treatments where a man injects a drug into the side of the penis to open up the blood vessels and cause an erection that way. We can use an external device, a so-called vacuum device, which essentially is a tube that goes over the penis. A suction is created within that tube and it allows the penis to be drawn up into an erection, and that erection is then maintained by a soft rubber ring that goes around the base of the penis. Or we can move on to something that actually fixes the problem, and the only treatment we have that fixes ED is a penile implant. Another option for patients is a vacuum device, which is a mechanical tube that goes over the penis, has a pump attached to it, so a vacuum is created within the tube, and that then brings the penis up into an erection, and after the patient then places a rubber ring around the base of the penis to keep it erect after they remove the tube. All those things I've been talking about are really ways of obtaining an erection, but they're not fixing the problem. And the only treatment we have that fixes ED is to insert a penile implant. So a penile implant is a device we insert inside the body at an operation. It's quite a small operation, takes about 30 minutes only to do. A small incision at the base of the penis where it joins the abdomen. And that enables the patient to have an erection anytime they want by inflating the hydraulic device through a pump that's in the scrotum between the testicles. So it's certainly a great way of overcoming the problem, indeed fixing the problem, done through simple surgery involving 24 hours in hospital and a short recovery time. So the best type of penile implant is what we call a fully inflatable implant, and that has a pair of cylinders that go inside the penis, a pump that goes in the scrotum to transfer the fluid into the cylinders, and a reservoir that sits inside the body. And the way this works is the reservoir is inside the body, near the bladder. And then what we do is have the cylinders, which are inserted inside the actual penis itself, and the pump which sits in the scrotum between the testicles. So the whole thing is internal, and it's all put in through one small incision done just where the penis joins the body here at the front. So when a man wants to have an erection with a penile implant in place, he feels the pump that's sitting down in his scrotum between his testicles, and the pump has two parts, a part to inflate and a valve to deflate. What he does is he feels the pump and presses on it, and that starts transferring the water from the reservoir that's inside his body through into the cylinders which are inside the penis. And as we pump, the cylinders will fill up with water, and because they're inside the penis, it really starts to look like a completely normal erection. So the cylinders fill up and become quite hard and quite erect. And because these are inside the body, this would look something like this. So here's the flaccid penis here, and then as the cylinders fill up, the erect penis. And you can make that as hard as you like. The harder you pump the cylinders, the more water you transfer from the reservoir through into the cylinders. So the man ends up with a very hard, very normal looking erection with these cylinders inside the penis, and all the rest of this is inside the body. When he's finished with the erection, he needs to press on these two little valves above the pump, squeeze those together for about 3 or 4 seconds, and the implant will actually deflate by itself. And you can see it just slowly deflating. Or we can actually speed that up by just squeezing the penis and pushing all the fluid out of the implant until the penis is completely deflated again. So again, if this was inside the body, this would be sitting here deflated inside the penis. With a penile implant in place, it enables the man to have a hard, rigid erection to have intercourse, but the other aspects of sexual function will be the same as they were before. If, for example, a man was able to have a normal ejaculation and a normal orgasm before, he'll continue to have a normal ejaculation and a normal orgasm. If for some reason he doesn't have an ejaculation, which will be the case after a man's had his prostate removed for cancer, or he will indeed have a backward ejaculation if he's had a prostate opening up operation for urinary problems, a penile implant's not going to change that. But certainly a man will have normal sensation on the penis, he'll be able to have an orgasm, and he will be able to have an ejaculation if he was able to have one beforehand. Yeah, one of the problems patients and their partners notice with a vacuum device is that it's really creating a firm but not hard erection, and it's actually a cold erection because the ring around the base of the penis stops blood flow into the penis. So certainly patients themselves find that a problem, and certainly their partners complain that the erection doesn't feel normal and it indeed feels cold. Now the difference then with a penile implant is that there's none of those problems. The penis looks normal, feels very hard, it's a warm erection, and there's no issues for either the patient or their partner in that regard. So it's really very much like a normal erection once it's inflated, and it has the spontaneity of being able to inflate it quite quickly and to deflate it when you're finished with it. Patients who use injections into the penis to cause an erection that way can usually obtain a good erection. The problem is it's not very spontaneous. In fact, it's one of the least spontaneous treatments we have. There are other problems that can happen with that. Patients can get bruising from the injection, they can get bleeding from the site of the injection, but of more concern is they can develop scar tissue inside the penis. And the problem if they get scar tissue is that ultimately the injections may not work, but perhaps even more importantly is it'll then compromise the quality of the result they'll get if they move on to a penile implant. Because if they develop scar tissue in the penis, they won't have a penis that's as elastic, it won't be able to stretch as much, and we won't be able to do as good a job when we do put a penile implant into place.